There is a desperate shortage of physicians in Southern California's minority and poor communities. And at the same time, there are hundreds of physicians who would love to practice medicine but can't. Ana Cuevas tells us about a program that is bringing these two needs together.
Buenas tardes, doña Florinda. ¿Cómo está?
When Vicky Caballero came to the United States from Mexico, she came with a prized possession, a medical degree in family medicine and more than 5 years' experience treating patients in Western Mexico. She was hoping to turn her training into a successful practice here in Los Angeles, but she never imagined it would take 15 years before she could practice medicine again.
We have the title over there in Mexico, but that doesn't mean that we can work over here.
Her degree from the Universidad Autónoma de Sinaloa wasn't valid in the U.S., so to survive, Caballero set her pride and skills aside and took a job making mini blinds.
How difficult was it after having been a doctor to then go work in a factory making blinds?
Really difficult, really depressing and hard to assimilate.
Her story is a familiar one to Dave Ramos. He works with doctors from other countries who emigrate to the United States.
Physicians who had high levels of education, in many cases specialty, but they're working as taxi drivers, construction, what have you.
Ramos is the director of COFILA, the Consortium of Physicians from Latin America, a nonprofit group based in Santa Ana in Orange County. Its mission is to help healthcare professionals from other countries navigate the complicated revalidation process.
Obviously, the person isn't working in their country, and then they're not using their talent here. So it's a huge waste of talent. One can just imagine the uses that there could be for this untapped human resources, which is international healthcare graduates.
Foreign-trained physicians often have to start the long and expensive process of medical school education all over again when they come here. That usually means going back to basics.
Which is the next one? We said, do not forget to go over this one.
This is one of the evening classes offered by COFILA. All of the students here have medical degrees from their home countries and are eager to get back into their field. The class is designed to help them with the first of 2 licensing exams. If they pass, they can then apply for a residency at a hospital. There are limited slots nationwide, and they are up against domestic medical graduates.
Not every doctor who arrives will be able to become a doctor. According to Ramos, every new student is told it can take up to 8 years before they can even enter a medical residency program. Add to that the 3 to 5 years it takes to complete, and we're talking about a process that can take well over a decade.
Even against those odds, there are many willing to give it a try.
For example, ¿qué te quiere decir?
That they have arteriosclerosis.
Claro.
2 years ago, 30-year-old Orangel Gutierrez returned to Southern California where he grew up. When he was in elementary school, his family was forced to move back to Nicaragua. After he finished high school, he went on to the Universidad Americana in Managua, where he became a surgeon. Coming back to the U.S., he knew he wasn't going to be able to practice as a surgeon, so he took the first job that came his way.
When I first got here, I wasn't doing anything, and I was sitting around the house. My aunt cleans houses, and I was, I'm not doing anything, and she told me how much she was making cleaning houses. I'm like, I'm there.
It was while working with his aunt that he heard about COFILA. According to Ramos, they recommended he at least start working in something related to his field.
They can refine their medical terminology in English, make contacts, get letters of recommendation they need to get for their long-term goals, and understand how the system works here.
For starters, they helped Gutierrez get a job as an interpreter at the University of California Medical Center in Irvine. He then worked his way up to medical assistant. Because he's only 30, Gutierrez is giving it his all to practice surgery once again.
There's some people that choose to take nursing or take other paths, and that's all good. But for me, when I have my eyes set on a goal, I'm going to do everything possible to accomplish it.
Gutierrez has time on his side. But what about older doctors and nurses?
A lot of doctors say, Dave, I just don't want to go through it. I got a family. what happens if I pass all the exams and I can't find a residency, which happens a lot. And especially sometimes when they're older, they say, Dave, I don't have the years, why don't I just go into nursing or physician assistant?
That was the case for Caballero. Married with 4 kids, it was impossible for her to spend all that time studying. So Cofila steered her in another direction within the medical field. She started out as a medical assistant and then went to school to become a physician's assistant.
I do everything. It's the work that medical doctors do, but we have to work under the license of a medical doctor, MD.
They share life experiences with their patients. So, for instance, if you really think about it, the patients that they're treating in Latin America, due to immigration and demographics, the type of same patient we're going to see here, especially in Southern California.
Otra vez? Okay.
Caballero says her language skills and cultural experience help her greatly in this predominantly Hispanic area. And studies show that Spanish-speaking health professionals are sorely lacking in LA County. In 2002, there was a shortage of more than 10,000. But that year, only 40 Spanish-speaking doctors graduated from area schools. And that's what Ramos is hoping to do, use the skills these men and women bring to fill that void.
Are they taking jobs away from domestic graduates?
No, they're not, because the jobs, even when they don't go in as physicians, these internationally trained medical doctors are going also into other high-need areas. There's not physicians who are looking for jobs from the United States and saying, I can't get a job because of these international medical graduates. It's just not happening.
Ramos says they get between 10 to 30 new students every week, some driving from as far away as Bakersfield. And even though all of them may not make it, Gutierrez says he understands why the process is so difficult and time-consuming.
You're not going to let anybody just come in and say, I'm a doctor, I have this paper here, you know, from Mazawanga or whatever country, and it says I'm a doctor. Can I go practice here? You're not going to let people do that.
Gutierrez is scheduled to take his first exam later this year. It's the first step toward being able to use that scalpel once again. As for Vicky Caballero, she's been a physician's assistant in Anaheim for almost 2 years now.
How difficult has it been?
Difficult. And but if I did that, if I can do it, everybody can do.
They can't call her Dr. Caballero, but it's a far cry and much more satisfying than making mini blinds. I'm Ana Cuevas for Life and Times.
Thanks for joining us on this special healthcare edition of Life and Times. I'm Val Zavala. Thanks for watching. We'll see you next time.
This Life and Times healthcare special is made possible by a grant from Queen's Care, a public charity providing health care to the low-income and uninsured residents of Los Angeles County, by the L.K. Whittier Foundation, dedicated to improving the quality of life by supporting innovative endeavors in the fields of medicine, health, science, and education, and by a generous grant from Jim and Ann Rothenberg,